Good morning to all. Myself Dr. K. Manoharan, Associate Professor, Department of Biomedical Engineering. So today class we are going to discuss about potential of AI in healthcare. So AI applications are growing rapidly in healthcare sectors. So it giving us so many benefits for a healthcare sectors. So some of the examples are curing disease, finding a cancer risk in early mining, again giving a medical tailored to each person. So these are the some of the early examples. So but the real benefit is combining all the things with this and giving a best results with the system. Look at this. So early detection, again improving a decision making, improving this help in a treatments, again this expand the access to medical services, associated care, giving superior experiences, checking health through the wearables, end of life care. So everything should be combined and then produce a system to get a best results. So real benefits come only if you combine everything in a single data set. So AI fully will be a data driven system. So because the output depends on the data set we trained. So AI process the large data set. Here we use medical images, EHR, electronic health records. So EHR will be maintained for each patient. So instead of health records that will be maintained in electronically, that's why it is called as electronic health records. Again, the personalized medicine and predictive analytics will be possible with this AI. Again, data to decision transformation that will be done with this AI. Look at this, how this flows will be happening. So in medical fields, how this will be happening in different sectors. Again, we use this fragmented data. So the patient data is scattered across the different devices and different hospitals and different places. So this will be scattered and that should be combined to get a better results. So we have a lag of infrastructure to combine these data. So once if we combine it, we can analyze and we can use it for a better results. This EHR remains massive and it will be hard to access the consistently. So only that particular hospitals and then prescribed persons only can access it, but it will be available in a public, so we can train the system to get a better results. So these electronic health records, this will be maintained with the hospital, doctors, again insurance companies and laboratories and then their personal that is patients. So we need to have toward a data fabrics. So this COVID-19 given best lessons for all the peoples that it pushed we need to link all data sources for a better results. So this data fabric is this is an unified system for managing and accessing the health data for all peoples. So we use the cloud platform that will be used for a full for storing that information. Look at this. So these are the cloud storages. Here the patient information. So these will be pushed in a clouds. So the first thing, ethical questions in AI. So whether should AI inform patients life-threatening risk? Like for example, if the patient is detected with cancer, whether AI should inform that information to the patient or not. So these are the some conflict information. So these should be addressed. Similarly, first, some sensitive predictions can be shared with healthcare teams or not. For example, we have a sensitive prediction. For example, they have some critical disease like a cancer or AIDS or some other things. So whether this information should be shared with the healthcare teams. Similarly, how we manage these unintended emotional or legal consequences. For example, if some information are leaked or something happening, how we are going to face this emotionally and legal consequence for this. So thus will be must be addressed for an AI to implement the all systems. So ethical AI, so we need to have all the things. So it should be a transparent and it should have a fairness. Again, it should be an accountability. Again, it should maintain this privacies. Again, we need to make a build the trust with the peoples. Again, we need to preventing the harms. So the future of personalized care. So COVID-19 given that highlighted that age, obesity, again ethnicity of risk factors. So we know that there is some risk with the things. So Oh, for example, if you have a patient with lower age and higher age, we cannot treat them equally. So that's why this is the important parameter. So this personalized digital care can have better treatments based on their age, based on their obesity, again their risk factors. So there have been every strong incentives to use AI for a better healthcare. So this is an AI can deliver a real-time, again individualized treatment for a individual patients. So this will be helpful for an elder people's again abuse, again hard to reach population. Entire population this will be difficult to reach it. So our goal is to proactive and preventive healthcare. So before appearing, we need to try the better results. Similarly, it should be a proactive. It should be fit for all the windows. The future of AI, we need to integrate the wearable devices and IoT to the AI devices. Then only we can track a real-time data. So based on that, we can give a better treatment. For example, if you go for a remote care treatment or a telemedicine, there we need to integrate this IoT with AI. So we need to move a higher preventive medicines to the peoples. So preventive is best thing. So we need to give a preventive maintenance. So the collaboration with AI experts and healthcare professionals is the key point that will help them for a better results. So they will be help them for a preparing a new model that gives a improved results. Thank you.